आज पीएमसी पाकिस्तान मेडिकल सेंटर का एनुअल इफ्तार था, जिसमें कम्युनिटी के जितने भी डोनर्स हैं, कॉर्पोरेट्स, इंडिविजुअल्स, सभी इनवाइटेड थे। इसको हम पीएमसी फैमिली कहते हैं, जो कि हर साल इफ्तार के मौके पे इकट्ठे होते हैं। और ख़ास तौर पे इसमें ये होता है कि हम पूरे साल की जो कारकर्दगी होती है, जो इसका सोशल इम्पैक्ट होता है पीएमसी का, वो उनसे शेयर करते हैं। जो फ्यूचर के बारे इनिशिएटिव्स हैं और ख़ास तौर पे जो हमारी पीएमसी की एक्सपेंशन का प्लान है, वो हमने आज शेयर किया उनसे। और ये प्रोजेक्ट हमारा तकरीबन 60 मिलियन दिरहम का प्रोजेक्ट है, जो कि पीएमसी को ऑलमोस्ट 3 टाइम्स उसकी सर्विसेज को बढ़ाएगा और इसके सरफेस एरिया को बढ़ाएगा। ये एक बड़ा यूनिक प्रोजेक्ट है। जैसे कि आपको पता है कि हमने 5 साल पहले शुरू किया और ये पूरे जीसीसी का पहला नॉट फॉर प्रॉफिट मेडिकल सेंटर है जो किसी कम्युनिटी की तरफ से शुरू किया गया हो। और इसकी खासियत यह है कि इसमें 126 नेशनलिटीज़, 126 मुल्कों के लोगों को मुस्तफ़ीद हुआ इससे। ख़ास तौर पे फिर ये है कि हमारे जो 2 बड़े इनिशिएटिव्स हैं, इसके अलावा पीएमसी एकेडेमिया जो रिसर्च और ट्रेनिंग वर्कशॉप्स और सेमिनार्स करवाती है, फिर पीएमसी पब्लिक हेल्थ जो हम लेबर कैंप्स में जाके लेबर्स को ट्रीट करते हैं। तो ये 2 हमारे इनिशिएटिव्स से पिछले साल के, और इंशाल्लाह जैसे हमारा ये प्रोजेक्ट कंप्लीट होगा, जो कि 60 मिलियन दिरहम का प्रोजेक्ट है, उससे हमारी सर्विसेज 3 गुना हो जाएंगी। और इसमें और नए जो हमारे यूनिट्स हैं उसका इजाफा होगा, ख़ास तौर पे डायलिसिस का यूनिट। डायलिसिस एक ऐसी चीज़ है जो कि यहाँ की कम्युनिटी की बहुत बड़ी नीड है और काफ़ी महंगी भी है। जिनके पास इंश्योरेंस नहीं, उनके लिए बहुत मुश्किल होती है। फिर हमारे पास एडवांस्ड रेडियोलॉजी भी ऐड हो जाएगी। इंशाल्लाह 2 साल का प्रोजेक्ट है और कम्युनिटी की सपोर्ट से इसको भी मुकम्मल करेंगे। और मैं शुक्रगुज़ार हूँ यूएई गवर्नमेंट के, जिसकी पूरी सपोर्ट हमारे साथ है, और अपनी कम्युनिटी बल्कि दूसरी कम्युनिटीज़ भी इस प्रोजेक्ट को ओन करती हैं और इसमें बढ़ चढ़ कर हिस्सा लेती हैं।
Good evening, welcome to what I call the PAD PMC family. It's an honor to have you here. Again, it's Ramadan time. We meet every year here, trying again to see each other, from all of us, from each other, how we can move forward. This is a year of family declared by. The concept of a family is basically to build a community. And family is just a unit. And I believe when we all get together here, this is also a form of a family where we have a common objective, a spirit to bring us together. And we form a family which then is a foundation stone for any community anywhere in the world. And I'm proud to have you all who have stood with us for many, many years. And I hope we will continue and grow in the years to come, inshallah. PMC has made a lasting impact. An impact which honestly even we didn't anticipate when we started off this journey. It's been almost 5 years plus, October 2020 when we saw our first patient here. And we have served up till now over 170,000 patients, out of which 75% of our patients are welfare patients. When I say welfare patients, these are patients who can't afford to go anywhere else. The rest of the 25% of the patients are again provided subsidized healthcare. And this is all possible from the contributions we have from the community, from the corporates, and more of, I would say, the volunteers we have here, whether they are doctors, nurses, or in any shape. And I think that's the backbone, that's the strength we have. People who come here to give back. And I think that's the true spirit of Ramadan, where we're actually here to share, to give back. PMC has evolved not only just a medical center, but as an institution. It has got the verticals of PMC Academia, which works towards research and training. Then we have a vertical called PMC Public Health, which is an outreach program. We go out to labor camps, we screen and bring people from the labor camps here, knowing that this is where we started our hunger journey almost I would say 2009, that's 16 years ago when we started off going to the labor camps. And I think that remains a backbone. People in the labor camps can't afford to come here, they can't take the transport and reach here. They have to work every day. So we have a team which goes out, screens them, and then bring the patients who need further treatment. Down the line, we felt that we are now reached to our capacity. Capacity where we need to deliver more, but we don't have space. We have people, we have volunteers, but we can't accommodate them anymore. And this is where then we reached out for an expansion. So we have applied for a special permission. This area you can have a ground plus 1 structure. So we applied for a special permission to give us a ground plus 2. Alhamdulillah, the government of Dubai has approved that. So we will be starting our work soon. The new project has got a basement for parking. It's got a ground plus 2 structure. The ground floor is going to be various components which are co-working spaces for the community, for the association. We'll have our admin block. We have a Jinnah Lounge. We have the Iqbal Center for Excellence in Leadership. We have Abdul Kadir Khan Center for Innovation and Entrepreneurship. And then on the first floor, we'll have PMC expansion, which will connect to the first floor from the front building to the back building here. And this will increase almost 3 times the space of PMC. Plus, the services are going to be expanded as outpatient. We will be adding a dialysis unit, an advanced radiology, including a CT and an MR with mammogram and a DEXA scan. We will have an expansion of our physio services, which is one of the most needed services and the most busiest unit we have at the moment. And then our dental unit, ophthalmology unit, will have speech therapy, geriatrics. So it will be almost 3 times what we serve today, inshallah. Along with that, we'll be expanding our lab services also. And then we also have a vision to have a mobile unit which will support our public health unit going out to the labor camps, inshallah. The first floor will be PMC, then on the top is our sports, which is going to be indoor. We call it again a wellness floor, where people can come in for various sports, and then the rooftop would be an open area which can be again used for outdoor sports, and we can have events like this. So don't feel that this space will be gone, this will be just shifted a bit higher up, inshallah. So this entire space is 89,000 square feet. It's going to cost us about 60 million dirhams, out of which 37 million dirhams goes towards construction and 23 goes towards the equipment and furnishing. We're very grateful and I would say blessed to have people like yourself who have already committed 26 million dirhams towards this project. So we're left with 34 million. Inshallah, I'm very hopeful that as we start the work, the rest would be also taken care of. And again, this is CapEx, and I can tell you that 5 years down the line, we have to raise every year for our OPEX, and not a single year we've ever been short of contributions from our community. Alhamdulillah, no patient has ever been turned away because we don't have funds available. So I think there are people who want to do good. They trust in this platform, but we need to give them more opportunities. We need to expand the services and then engage not only individuals but corporates. We have corporates. I'm proud to belong to Mediclinic. I have my entire team here who've been our partners from day one, giving a blanket NSC to all the doctors, nurses working at Mediclinic. Likewise, we have other healthcare partners. So we provide a platform where we can join hands and then give back to the community. Likewise, we have corporates who have owned certain units. We have various services like physiotherapy, cardiology, gynecology, pediatrics, who are owned by particular corporates who would pay for any patient who walks into those services who can't afford to pay. Then along with this, we have developed our referral pathways. So referral pathways is if we have a patient who needs further treatment and we don't have that as in-house, then we can refer them to another hospital. And again, I'm proud to say Mediclinic has extended hands, where we have a fund allocated for people who need further surgeries, where the surgeon will not charge, the anesthetists will not charge. We have the medical industry giving us consumables for free, and then we have the patient paying nothing from the pocket. So I think, again, anything is possible if you all collectively think together, if you join hands together, we can do wonders. And there's so many people in need, which you only realize when you come and meet them here. How much time we have? So, what I would like to do is give you an opportunity. We have some pledge cards on the table. The pledge cards, a lot of you have already pledged, you're already contributing, but I see lots of new faces here today. I would like you to take a moment, have a look at them. It gives you an opportunity to either contribute, bring a month, it goes towards our operations, and we have made it easy for people to contribute, where you have a tier of 5 types of bricks, starting from 200 dirhams a month to 10,000 dirhams, and we can go beyond. So that's easy for people to contribute a small amount every month. And then, as I said, there are corporates, there are individuals who have owned services, they can continue doing so. And again, a very small number of people here. There are lots of people who still belong to this family, but they couldn't come today. But I believe there are people who are not even aware that there's an activity happening in town. So it's important that you all act as ambassadors. You talk to people, share with them, give them the opportunity, bring them here, let them see. Seeing is believing. They can come and see what's happening. They can experience themselves and be part of it. Again, I think this is an opportunity which has been given by the government of UAE. We started off as a pilot project, and this wouldn't have been possible with the support of the Community Development Authority, who gave us the permission to do this activity. The Health Authority, Department of Finance, who waived off all the licensing fees for the doctors and for the facility itself. So again, it's a very unique model of inclusion, of joining hands, and of tolerance. I believe this is the essence of this place where we are here, that we all work in harmony, we all tolerate each other coming from different backgrounds. And I think this is a very beautiful example where we have patients coming from across 126 nationalities. We have doctors coming across from various nationalities, even our staff is a mix. And then we have internship programs. We have MBRU as a partner. We have summer scholars programs, students coming here for attachments. We have an internship program for high school students. Over 300 students have gone through our internship program. Again, they come from 30 plus nationalities. So yes, we carry the name Pakistan Medical Center or Pakistan Association Dubai, but this is a place where we feel that we are one family across all nationalities, across all ethnicity, all religions. Everyone is one here. And this is Alhamdulillah, this is only possible with all of us believing in the cause. And as I said, this is a family. I would like you to continue to be part of the family and allow the family to grow, inshallah. Thank you so much for being here.
की मेरी और मैं खुदावंद का शुक्र करती हूँ कि जो है मैं अभी बहुत बेहतर हूँ, मैं अच्छा चलती हूँ और मेरी गर्दन के जो मोरे हैं वो भी काफ़ी बेहतर हैं।
इन्होंने मुझे वेलफेयर हुआ, मेरे डीपी लगी, मेरा लेग फ्रैक्चर हुआ था और डॉक्टर ने फ्री चेकअप किया।
5 साल